Good day, this is Professor Will, CBMD PhD. Today is Wednesday, March 25th, 2020. It is 4:52 and 8 seconds p.m. Eastern Standard Time, and the lectures of my series on Corona continue. So let's get started here. Study reveals how long COVID-19 remains infectious on cardboard, metal, and plastic. People may acquire coronavirus through air and by touching contaminated surfaces. Date March 20, 2020. Source: University of California, Los Angeles. Summary: the virus that causes COVID-19 remains for several hours to days on surfaces and in aerosols, a new scientific study has found. Studies suggest that people may acquire the coronavirus through the air and after touching contaminated objects. Scientists discovered the virus is detectable for up to 3 hours in aerosols, up to 4 hours on copper, up to 24 hours on cardboard, and up to 2 to 3 days on plastic and stainless steel. The virus is quite transmissible through relatively casual contact, making this pathogen very hard to contain. If you are touching items that someone else has recently handled, be aware they could be contaminated, and wash your hands. The study attempted to mimic the virus being deposited onto everyday surfaces in a household or hospital setting by an infected person through coughing or touching objects. For example, the scientists then investigated how long the virus remained infectious on these surfaces. In February, researchers and colleagues reported in the Journal of eLife that screening travelers for COVID-19 is not very effective. People infected with the virus, officially named SARS-CoV-2, may be spreading the virus without knowing they have it or before symptoms appear. The biology and epidemiology of the virus make infection extremely difficult to detect in its early stages because the majority of cases show no symptoms for 5 days or longer after exposure. Many people won't have developed symptoms yet. Based on our earlier analysis of flu pandemic data, many people may not choose to disclose it if they do know. The new study supports guidance from public health professionals to slow the spread of COVID-19. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover coughs or sneezes with a tissue, and dispose of the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a household cleaning spray or wipe. ACE inhibitors and angiotensin receptor blockers may increase the risk of severe COVID-19, paper suggests. Date March 23, 2020. Source: Louisiana State University Health Science Center. Summary: a possible explanation for the severe lung complications being seen in some people diagnosed with COVID-19 is proposed in a new article. The SARS beta coronaviruses, SARS-CoV, which caused the SARS severe acute respiratory syndrome outbreak in 2003, the new SARS-CoV-2, which causes COVID-19, bind to angiotensin-converting enzyme 2 ACE2 receptors in the lower respiratory tract of infected patients to gain entry into the lungs. Viral pneumonia and potentially fatal respiratory failure may result in susceptible persons after 10 to 14 days. Angiotensin-converting enzyme inhibitors, ACE/LS, and angiotensin receptor blockers, ARBs, are highly recommended medications for patients with cardiovascular disease, including heart attacks, high blood pressure, diabetes, and chronic kidney disease, to name a few. Many of those who develop these diseases are older adults. They are prescribed these medications and take them every day. Research in experimental models has shown an increase in the number of ACE2 receptors in the cardiopulmonary circulation after intravenous infusions of ACE inhibitors. Since patients treated with ACE/LS and ARBs will have increased numbers of ACE2 receptors in their lungs for coronavirus S protein to bind to, they may be at increased risk of severe disease outcomes due to SARS-CoV-2 infection. This hypothesis is supported by a recent descriptive analysis of 1,099 patients with laboratory-confirmed COVID-19 infections treated in China during the reporting period, December 11, 2019 to January 29, 2020. This study reported more severe disease outcomes in patients with hypertension, coronary artery disease, diabetes, and chronic renal disease. All patients with the diagnoses noted met with the recommended indications for treatment with ACE/LS or ARBs. Researchers say that two mechanisms may protect children from COVID-19 infections: cross-protective antibodies from multiple upper respiratory tract infections caused by the common cold-causing alpha coronaviruses, and fewer ACE2 receptors in their lower respiratory tracts to attract the binding S proteins of the beta coronaviruses. Researchers recommend future case control studies in patients with COVID-19 infections to further confirm chronic therapy with ACELS or ARBS may raise the risk for severe outcomes. Patients treated with ACELS and ARBS for cardiovascular disease should not stop taking their medicine, but should avoid crowds, mass events, ocean cruises, prolonged air travel, and all persons with respiratory illnesses during the current COVID-19 outbreak in order to reduce their risk of infection. Good day, this is Professor Will, CBMD PhD on infectious disease and pathophysiology. Well, I hope you enjoyed listening and have a great day.